In Part 5 of Module 11 on entitlements, we'll discuss healthcare and Medicare. Three major forms of healthcare policy entitlement exist in the United States that affect state and local governments in major ways. Those entitlement programs are Medicare, Medicaid, and S-CHIP. Medicare is the federal health care program for the elderly. Medicaid is a state program cooperatively managed at the state and federal levels of government to meet the health care needs of low-income individuals and families. S-CHIP, or the State Children's Health Insurance Program, is also a state program cooperatively managed at the state and federal level, intended to meet the health care needs of uninsured middle and low-income children. While a national program, Medicare is an important part of maintaining sustainable state and local communities. The Medicare plan provides for the health care needs of individuals 65 years of age or older. Recognized Medicare program health care providers privately supply health care under Medicare. There are three major components to coverage. Part A, hospital insurance. Part A covers specified costs of hospitalization, nursing care facility stays, home health care, hospice care, and blood transfusions for patients staying in the hospital or during covered stays in a skilled nursing care facility. Medicare does not cover all costs of every medical procedure. Part B, medical insurance. The Medicare program covers a percentage of Medicare-approved procedures. Costs that exceed those covered by Part B are the responsibility of the patient. The patient may choose to enroll in private health insurance plans to cover additional expenses or choose to enroll in government-sponsored Medigap insurance. Expenses not covered by either private insurance or Medigap are the responsibility of the patient. Part D, prescription drug program. The prescription drug program covers expenses for various generic and brand name drugs. The copayment of the patient will vary depending on the type of drug prescribed. Medicare Part D coverage limits the amount of drugs dispensed at any given time. The oldest members of the baby boomer generation are now in their 70s and becoming increasingly susceptible to the infirmities of age. By 2030, it is estimated that there will be 2.7 workers for every retiree drawing health and retirement benefits. Economic sustainability is being challenged by a growing tax burden and budget constraints. The sustainability of the Medicare program as it currently exists without significant change is highly dubious. Either a reduction in benefits or changes in eligibility might be necessary to make the program viable for future generations if no alternative healthcare financing system is created. Policy changes at the national level, however, will not reduce the expanding healthcare needs of the elderly. Preventative care, good health practices, and effective outreach to at-risk populations are all important ways of limiting healthcare needs and economizing on healthcare expenses. Regular exercise and balanced diets are important to maintaining good health, and avoidance of smoking and moderation in the use of alcohol are important means of reducing healthcare costs. Public-private partnerships involving national, state, and local government are critical to making available the wellness information, healthful foods, and exercise facilities needed to stay healthy and providing access to geriatric nutrition information for the elderly. Medicare and its related health care programs for the elderly provide a solid foundation for health care entitlements in the United States. Sustainable elder care, however, involves much more than health care dollars for hospitalization, health insurance, and prescription drug benefits. The essential margins of health care sustainability for the elderly will most likely be provided by sustainable community-based elder care. Sustainable community-based elder care is a community-based provision for the needs of elderly residents that seek to maintain a community's retired population by providing for them within the community. Those communities which provide for the needs of both the young workers and the elderly individuals for whom they care will likely prosper. Those that leave the elderly to rely entirely on the federal government's Medicare program will experience serious dislocation as the baby boomers move into their retirement years. In Part 6 of Module 11 on entitlements, we'll discuss Medicaid.